Starting Point Coaching and Consulting presents Kairos Conversations, Connecting with Quality, the podcast. Kairos is Greek for the right time, the right season, the right opportunity. This podcast features healthcare quality professionals who share their journeys, their advice, their struggles, how they made that transition into a new and exciting role. My heart's desire is that you find this podcast to be inspirational to you as you make your own journey. Don't forget to share this podcast with your colleagues and friends and rate us on whichever podcast platform you listen to. Thank you for being here. Thank you so much for tuning in today. Today, I am joined by my next guest, Dr. Valerie Daniel. Thank you so much for being here, Valerie.
Thank you so much for having me. It's a pleasure to be here.
I am super excited to have this conversation with you. So let's start by introducing yourself to the audience.
Well, thank you very much. My name is Dr. Valerie Daniel. I am the owner-operator of a psychotherapy private practice called Life's Crossings, and I am located in Pennsylvania, and I do that full-time.
So let's go back a little bit and tell the audience, and I want to know too, because I don't know this, how did you get to the point where you said, I want to work as a psychotherapist? Because most people don't even know what a psychotherapist is, right? So how did that career path start?
Well, it started really haphazardly, if I'm being completely honest. My undergrad degree is in journalism, and I was graduating from journalism from Temple University, as a matter of fact. That's where I graduated from. And I was looking for a job. And I wanted to break into, radio, television, film, something. I was going to be, somebody's speechwriter or something. I didn't know what it was going to be, but I was going to do something in the field. But I couldn't find a job. And I needed a job. And so I had a friend that I went to school with who was working at a residential program for folks that had intellectual and physical, mental disabilities. And they were looking for help. And I was like, I don't know how to do that. I'd never done that before. Couldn't imagine. But I went in and somehow got the job. And probably after the first 2 shifts, I was like, oh, I kind of like this. So I didn't know what this was in terms of where it would take me. But I realized there that I liked helping people. I liked working with folks that were struggling in whatever ways they were struggling. And that was the beginning of the path. As I moved forward with the work and moved into different positions, I learned more things about myself that made me think doing this work full-time, long-term would work. I still wasn't I want to be a therapist, but I knew I wanted to keep helping people. I knew I wanted to stay in this field in some way, shape, form, or fashion. And so that led to a ton of different jobs within the field. And then I got to a point where I was working in child welfare, and I was looking to try to make some moves and get a promotion, get a raise, all that good stuff. And I kept hearing, oh, well, you'd be great for this position if you had another degree, if you had a master's. And I was like, crap, I don't want to go back to school.
More education, right?
More education, right? I was like, I don't want to go back to school, because when I graduated with my bachelor's, I was like, I am never doing that again. So I kept hearing, you need to go back to school. You need to go back to school. You're really good at this. You need to go back to school. If you get your master's, it'll be great. So I wound up having a boss, supervisor at the time, who had his MSW, and just getting to know him, seeing what he was doing, how he was doing it, and the things that he was doing on the side, that he was making extra money doing this and doing that. And I was like, well, if I'm going to go back, maybe that master's in social work might work. I knew I didn't want to keep working with children, but he was the first person that let me know that there was a degree that it could be as versatile as a degree in social work could be. Mm-hmm. And so I hemmed and hawed for a while. I got another job and applied for a master's program, got in. And then the very first week of the program, the director of the program was talking about the different tracks that you could take in the program, and you had to declare by the end of the first semester. And she said the clinical track. And I remember going, okay, what's that? And so as she started talking about it, I was like, so wait, there's a way you can talk with people and help them without having to be a psychiatrist and go to medical school?
Sign me up.
That's exactly what I said. I was like, sign me up. And I was on the clinical track from that point forward. And for me, it was just a matter of that felt like the best fit of my skill set was to be able to do what I do now, and talk with people one-on-one and work with them on an individual level. But I didn't want to, again, stay in child welfare or any of the other areas that I had worked in. I knew I didn't want to do that. And so clinical worked. And once I made that decision that first week of the master's program, I never looked back.
So what's the difference between a psychotherapist and, let's say, like a licensed counselor, right? Because you have you're a license, what is it, LCSW, which is a licensed clinical social worker?
Correct.
So what's the difference? Or when would somebody come to you versus going to a counselor?
A counselor, generally, well, you can get a master's in counseling. You can get a master's in a variety of different types of counseling. So you could go to any of those folks as opposed to coming to me if you wanted. What makes at least in my opinion, my humble opinion, what makes the LCSW and a master's in social work, I think, so unique is that they are tailored so that they can work with any population from cradle to grave. Mm-hmm. Whereas the other ones are a little more specific. A master's in counseling generally has a subset of you're working with kids or, you're working with drugs and alcohol. So it kind of puts you in a already pre-made box. Mm-hmm. Whereas LCSW says you've got a master's in social work, which has taught you to work across generations and across populations. So you could work with children one week and be working with seniors the next week. You could be working with drug and alcohol one time to folks with intellectual disabilities the next time. The degree is extremely flexible in terms of where it says you can work, whereas the other ones have a little bit more limitation to what you can do.
Okay. And do you see in your practice, other healthcare professionals as clients?
Yes.
And the reason I ask that specifically is because a lot of my audience and those that listen to this podcast are healthcare professionals. A lot of them are therapists, physical, occupational, speech therapists. And a lot of time they may be hesitant to seek, therapy or to seek help because of the fear of what it may do to their clinical license.
Well, that's a good point. And I will touch on something that you may or may not have decided that this was going to be part of our conversation, but this is where I will say, depending on who they're looking for, you may want to look at someone that's in private practice and you may want to look at someone that doesn't take insurance. Because of those reasons, I have lots of healthcare professionals on my roster, but I'm not reporting to any health insurance agency about any of them because I don't take insurance. And so I don't have to report to anybody. Now, I have no problem with anybody that does take insurance. That is fine. But my practice has wound up having a lot of healthcare professionals in it. And for one of those reasons that I don't take insurance is because of that. I never want that to ever possibly interfere with anybody's career. And I know how important mental health is for anybody that's in the healthcare field. This is a lot of work. Mm-hmm. It's a lot of work. You give everything of yourself for your patients, for your clients, whatever term you use to call them. You need to have a safe place where, you don't have to worry about your health insurance having a report on, you were diagnosed with anxiety or depression or whatever it is. Yeah, I didn't want that barrier to be there.
Okay, so you run a private practice where you take clients who have insurance and clients who don't have insurance so that you can protect them, or actually, not have to, like you said, not to have to report to a regulatory agency about their particular situation or diagnosis.
Right. Because if I take insurance, that means that the insurance company ultimately has rights to my notes, to my files, to everything in reference to that particular client. And I didn't want that. I didn't want you to know what kind of diagnosis they had because I know that a mental health diagnosis doesn't mean that you can't do your job. It doesn't mean that.
Yeah, absolutely.
Yeah, but I know in a lot of places and spaces, unfortunately, it can be held against you.
Yeah, and that just bothers me, right? Because we're expecting healthcare professionals to be perfect, right? To not have cares and concerns in life outside of taking care of patients. But we're human, right?
Right. Well, I mean, I think that's one of the, issues in terms of healthcare. We as the healthcare workers are the least taken care of.
Yeah.
Yeah. We as the healthcare workers, we're the least taken care of. It's crazy. It's crazy. How can you expect doctors to do 24-hour shifts? And what are they supposed to do with all of that by the time they're done?
Exactly. And they have to be on all the time when they are at work, right?
Right. Right. How do you expect them to truly go to work and function and give their best? So for me, it was a no-brainer. I mean, again, there are plenty of other folks that take insurance, and if that's where you need to go, I have no problem with that. I've worked with folks like, hey, let me help you vest your list, and let's see who might be a good fit for you.
The biggest mistake I see clinicians make when transitioning away from direct patient care is applying for every available role. Problem is, it's like throwing darts at a board, hoping something sticks. And let's be real, employers can sniff this out like a canine, and it makes the candidate come off as unfocused. The solution, my friend? Do some deep introspective work to identify your passions, skills, and strengths, and find roles that align with that. That's why I've partnered with Career Clinic, who created the healthcare career profile that I wish I had created first. It's called Stream Ahead, and it takes about 10 minutes to complete. It is time well spent to get detailed report of the top work streams that fit who you are. I'll link the assessment in the show notes section of this podcast. And you can use the code BRANDY10, that's BRANDY10 for 10% off. Now let's get back to today's episode.
Now you have your PhD as well.
Yes.
Talk about how you decided to get that and what is that in?
Well, I didn't initially decide.
It was decided for you.
It was decided for me. One of the things I have also done in my varied career is I've been a college professor.
Okay.
And I got a job at a 4-year institution. And one of the requirements for maintaining that job was to have a PhD, because I couldn't go for tenure. I couldn't do any of those other things unless I had a PhD. And so once again, I was like, I said I was not going back to school. And here again, somebody telling me I got to go back to school.
Same.
Yes. But I really liked teaching. I really liked being on the college campus. At that point, I had also taught at my alma mater as an adjunct. So I was really enjoying teaching, and I was doing a little therapy part-time. And so I thought, well, I've seen other people do this. They have a, private practice on the side, and, they teach. So I could do that. So I decided at that point to, okay, let me go on ahead and do this. I'm going to keep this job and I want to keep teaching. I'm going to go on ahead and do it. So that's how I got into a PhD. My PhD is, I like to say, it's a regular old PhD like you would get from anywhere. The specialization is social work. It's not a doctorate. It's not a DSW. It's a PhD with a specialization in social work.
Got it. So with your numerous years of experience in clinical social work, what are some of the challenges that you've seen in healthcare with patients or with colleagues?
Well, I'll start with the patients first. I'll say one of the biggest issues that I see that is still an issue is the disparity between men and women, and especially between Black women and any other group, in all honesty.
Right.
That disparity in research, in advocacy, in legislation has led to issues across the board. It's led to there not being as many folks that look like you and I in the healthcare field as there should be.
Right.
It's led to folks that look like you and I not getting the healthcare in terms of access and quality that they need to have.
Right.
So that scares me because I know how often folks come to me and it's like I'm a unicorn, you know. They've never seen anything like me before because I didn't even know somebody like you existed.
Right.
It shouldn't be that way. You know, it shouldn't be that I am a rarity, that you can find all these other folks with PhDs, LCSWs, LPCs, whatever, but they don't look like me.
Representation matters.
It does. It does. So I think that's an issue. I know, you know, we've just started to get some research coming out about when women are your healthcare providers, how much that makes a difference in your longevity, your lifespan, and your quality in terms of your life and your outcomes. So I'm hoping with this current administration, as much money as they have put into research for medical stuff, you know, we're looking at, we're looking at mortality rates. We're looking at, you know, what's going on with our maternity, you know, issues in terms of lifespan and healthcare for women, especially Black women. So I'm hoping with this uptake in the money for research, it's going to, one, draw folks into the health and human services part of this and the public service, you know, part of healthcare in terms of wanting to serve, to do that research. And ideally, that's also going to mean that it's going to open up the doors for more folks that look like you and I that are going to want to come and be on the front lines and do the work. Because if there's more of us doing the work, there will be more of us that will be willing to take a chance and come and talk or come and do whatever it is, get physical therapy, whatever it will be. They're more than likely to do it if I see somebody that at least looks like me, because you understand.
Exactly. And representation on both sides, right? Representation for people who want to also do the work that we do.
Yep.
And also representation from the people that we are caring for to know that we understand their walk of life or what they may have been through.
Yes, exactly. I do clinical supervision for other master's level students that are looking to get their clinical license like I have. And again, even in that arena, I cannot tell you how many times I hear, "Oh, I'm so glad I found you. I was hoping I could find a Black supervisor." Again, I'm grateful and appreciative for the work, but it shouldn't be that way. It shouldn't be that way. I look at all of the folks that I went to school with for my master's, and myself and one other person in my cohort chose the clinical track.
Mm-hmm.
Every single one of them now has circled back and said, "I need to get my clinical license." Yeah, because I tried to tell y'all all that other stuff. This clinical license is where it's at. So it's having more of us out there. I try to talk to, you know, students, graduate level, bachelor's level all the time, because I want them to see there is somebody that's doing this a different way. You don't have to get a master's in social work just to work at the hospital or, you know, work at the prison. There are other ways and other things you can do that will also add to the field.
Yeah. So how do you, or what advice would you give someone who wants to get into the field and, you know, is facing some barriers, which the barriers can be varied, but what advice would you give them if they wanted to do work like you do?
I would say follow your passion. And even if you don't know what that means, as I've said in this, you know, in our conversation tonight, follow your passion, because I didn't know necessarily what it was going to be, but I knew I wanted to help people. Once you know what it is, and if it is social work and this is where you want to be, tune out all the naysayers, all of the, "Oh, you won't make any money and you're going to be working for pittance, you're going to be taking people's kids," all that. Take all of that out your brain.
Mm-hmm.
And focus on the passion of why you want to do this. If you know I enjoy helping people, and if you want to do this part of it, like I'm doing the clinical work, come on in. Follow your vision of what you think this could be, because I promise you, you will hear a lot of people tell you no. I did as well. If I can do this, so can you. Stay the course, so can you. And MSW is one of the most flexible degrees you could have. You get it, and you can work anywhere in the world. You can work from wherever you want to work, and you can work with whatever populations you want to work with and still get your side hustle on. Because I know I'm a side hustle girl, no matter what. I'm a side hustle girl. You can still get your side hustles on too, and you can make money and have a good life and know that you are giving back.
I love that you said that, Valerie, because, you know, sometimes we feel like we have to have it all figured out at 18 years old. but it changes over time. And if you follow what you love to do,
Yep.
then you can find different ways to do that, right?
Yeah.
And like you said, the social work degree is very flexible.
Mm-hmm. Mm-hmm. Yeah, because I truly, if I could go back and talk to my 25-year-old self and be like, girl, one day you're going to be called doctor. What?
Same, I would have been like, who are you talking to?
You lost your mind. I don't know who you talking to. I don't think so. But again, what stayed true for me from graduation from undergrad was, I found this thing I like. I like helping people. And as long as I followed that, it led me to social work, which led me to a master's, which led me to a PhD. But once I got here, I was fine. You don't have to have it all figured out. And trust me, I'm sure you do too. I speak with lots of these younger generations and they think everything needs to be figured out, mapped out, laid out by 30.
Yeah, because that's what we see, right? We see, especially now with social media being so big, and we can see everybody's life, or at least highlight reel, all day, every day.
Yep.
It leads to all this comparison about where we're supposed to be instead of focusing on our own journey. And I'm guilty of it too. You see someone else's journey and you feel like you're behind, or you're not where you should be, or whatever the situation is. And I think that is a product of everything being so readily available.
Absolutely. Absolutely. I do a lot of talk with my clients that are in this generation of this this instant gratification. No. If you get everything by 30, what are you going to do with the next 70 years of your life? They start laughing like, oh, I hadn't thought about that. Like, yeah.
Some of the best inventions and stuff come up later in life because, Valerie, I know who I am more now than I did when I was 20.
Exactly.
I am not the 20-year-old version of me.
No, and that's my point with this. It's a journey. It is not working on getting to the destination. It's about the journey. The journey is the self-discovery of being able to say what you just said. I can look back at 20-year-old me and know I am not the same person, for better, for worse, but I'm not the same person. And you shouldn't be. You shouldn't be. You shouldn't be. Because if you are, then that means you're stagnant or you burnt out 20 years ago. What are you doing?
Yeah. No, you're absolutely right. So for the person who is thinking, maybe I need to see a therapist, a psychotherapist, maybe I need to talk to someone.
Yes.
But they're not sure if their, and I say this in air quotes, their problem or their situation is big enough, right? Because we all compare that too.
Yes.
What would you say to them? Like, who is the person that would benefit from, seeing a psychotherapist?
Everybody. A good therapist has a therapist. Everybody would benefit because it's not about fixing what's broken. It's about getting you to be the best version of you. It's not about
that's good. That's a mic drop right there.
Because it isn't. It isn't about fixing what's broken. That's the medical model. You're broken, you come in and we fix you.
Mm-hmm.
That's not what therapy is. At least from not how I do it, not the way I was trained. It's not about that. It's about what's the best version of you and how do we help you to get there? Do we have to deal with crap from your past? Yeah. That doesn't mean that it's going to stop you from growing because it's about the growth.
Mm-hmm.
So no problem is too big or too small. And even if you don't have a problem and you just need a safe place to talk, come. Or maybe you're somebody like me who was always the person that everybody came and talked to.
Yes, that part.
Yes, because that was the real beginning. If my mother was here, she'd tell you, oh yeah, she'd been doing this well before she was an actual therapist. If that's you, then you need someone to talk to too, because you carry the weight of all your friends, all your family, your coworkers, significant others. And where do you go to lay your burdens down? Therapy is for everybody.
That is so good.
Therapy is for everybody.
That is so good. And I agree with what you said, because when I have been in therapy myself, I have found that it has been a place where I can feel heard.
Yep.
I feel validated, right? Mm-hmm. And it's given me a new perspective. The therapist hasn't necessarily given me all the answers or told me what to do.
Right.
but they help me to process
Yes.
my own thoughts, situations, feelings. And because sometimes when you talk about it,
Yeah.
it brings it into clarity.
Yes. 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 I tell folks, my opening statement with all of my new clients is, just because there are a whole lot of letters behind my name at this point in my life, I will never be an expert in you, because I'm not. But what I can do is provide a safe space for you to hear yourself think and try to help you see where that leads you to the best version of you.
I like that. The best version of you.
Yeah.
Not Valerie trying to make Brandy Valerie.
No, because I don't want a whole bunch of little me's running around.
Oh my gosh. Yeah, but I think that maybe that's like a misnomer or whatever that people think. I don't know all the reasons people have for not seeking help, but I know from a healthcare perspective, sometimes it's just the perception of what people will think.
Yeah.
And what that will mean for my ability to work.
That is a big part of it. And again, I think we look at therapist as part of that medical model. You have to be broken in order to come and see me. We don't function on the medical model. That's not what we do. So it's never been about, oh, you're broken, now you can come to me. No, you can be quite healthy and come to me.
Preventive.
Yes. Just like you go get your teeth cleaned on a regular basis so they don't fall out and you ain't got no raggedy mouth.
Yes, ma'am.
Yeah, you don't wait until they about have fallen out. You go see your dentist on a regular basis. Come see your therapist on a regular basis.
Yeah, for that maintenance too.
Yes.
Like even when you get to a place where you feel like you're good, sometimes it's good for maintenance purposes.
I have clients that's what we do. We are in what I call the maintenance track. Everything is going well. There's no major issues going on in your life. However, you still want a safe place to check in. That's relevant. Life is, as these young folks say, life be lifing.
Yeah.
You need somewhere to go and unpack life. That doesn't mean that there's something wrong. It just means life is lifing. So
how can people get in touch with you? Do you work across state lines?
Yes. I work in Pennsylvania now. I'm licensed currently just in Pennsylvania. I am waiting for the state of New Jersey to approve my license in New Jersey. I've done all the paperwork. And so I'm about to be recertified and relicensed in New Jersey. So right now, just Pennsylvania, but give me probably another, I'll say 3 weeks, and I'll be licensed in New Jersey as well.
So for any of my audience in any of those states, you can reach Valerie at lifescrossings.com.
Yep.
Lifescrossings.com.
Yes.
And I'll also link to your LinkedIn page.
Thank you much.
And your website in the show notes so people can access you. But even if people, and I just want to say this for people who are not in Pennsylvania or New Jersey, if you need someone to talk to, there are plenty of resources in your own state. There are resources with your employer if you want to go the employee assistance route. It's called EAP, Employee Assistance Program. You have the big names out there that have all the commercials for seeking help. So there is help out there if you want someone to talk to.
Yes, indeed. Can I just add one thing that with EAPs, that is one of the ways for myself and for a lot of other therapists that don't take insurance, that is one of the ways that they work at trying to lower the cost for folks is working through EAP. So you can find some really good therapists through your employee assistance program.
Oh, and quick question before we end the call.
Yes.
For people who might want to know, for the employee assistance program, if I'm an employee of a company and I use their employee assistance program, does my employer have access to my psychotherapy or counseling records?
What I will say is what I've learned over the years is each employer contract is different with the EAP. What they will generally know at the very minimum is that you access the services. Most times they can't get more than that, other than that you access the services and how many sessions you used, but they won't get access to your session notes. They won't get access to a diagnosis. But again, it's employer contract based. So, and I work with several different EAP programs, and they work with a multitude of companies across the country. And so each contract is different. but you can ask that. Typically, they're covered by HIPAA, and so they're not allowed to do anything more than say that, yes, employee 547 utilized EAP services in this quarter, or EAP number, person 534 utilized 5 sessions in the last 6 months, but they can't tell you what it was about.
Okay. Well, that's good to know. Well, I have really enjoyed this conversation, Dr. Valerie. You are so much fun.
And thank you. You were blessed as well.
Thank you for taking the time to share with my audience. I really appreciate it.
Thank you so much. It was a pleasure. It really was. And if there is anything that I can do to help anybody out there that's listening, especially someone else in healthcare, please know that you can reach out to me in confidence, and I will help you to do whatever you need to do to get the help that you need.
Awesome. Thanks so much.
You're welcome. Have a good one.
Thank you so much for listening to the show. It would mean a lot if you would share this episode with a friend or a colleague. I would be honored to encourage them in their journey too.